Hey, joining me now, Jim Cole. Jim is the longtime president and CEO, that means head honcho, of the Virginia Hospital Center in Arlington, Northern Virginia. And we're pleased to have Jim join our program. He's also the chairman of the Virginia Hospital and Healthcare Association's board of directors. So this is like a bigwig. And he's a nationally respected executive who's led his hospital to recognition as one of the best healthcare facilities in all of America. Hey, Jim, good to have you with us, man.
Good morning, John. Glad to be with you.
Now, I want to get right to the heart of the matter, if I may. Healthcare is one of the big issues of our time. Big issue. And baby boomers are aging, like me. I'm 57. Everybody knows that. That means there's going to be greater demand for care. We've got insurance industry mega mergers. So now there's only a handful of insurance companies now remaining in the United States that actually that offer health insurance. We've got Obamacare, or the Affordable Care Act. So it seems to me, as we go into kind of the second phase of now what do we do, that we have two main issues. One is the relationship between people who need medical care and the providers who fill that demand. The other is, well, let's call it the pink elephant in the room. How do you pay for it? Now, that seems like a challenging environment for hospitals and healthcare providers. Hospitals kind of stuck in the middle. Jim, what is the answer?
Well, John, I'd say you nailed it. It is a pretty challenging environment. I think most of us in Virginia really value our relationship with our local community hospital and sort of assume it's always going to be there for us, you know, for those very personal events like the birth of a child. That comes to mind because I have a beautiful newborn granddaughter, or, you know, a parent's illness. We have very personal experiences with our local hospitals. And hospitals are also there in times of the big national emergencies. If you think back to the Ebola crisis or even 9/11, emergency rooms are expected to be there. And I think most Virginians think that their hospitals are very stable and will always be there. But the reality is really much more complex. Today, hospitals are facing some serious financial challenges, and there are several reasons for that. I think the first and most basic is that, you know, hospitals care for patients who can't afford to pay their bills.
Right.
It's a legal obligation, and we take it very seriously. But that makes us different from other businesses because of that duty to give some services for free.
Right.
So, and, you know, when you talk about indigent care and payment shortfalls, Virginia hospitals in 2013 missed out on $1.5 billion in revenue that was owed to them. That's billion. Now, how does that happen? Well, you know, obviously there's folks who just can't pay their bills. But then, by design, Medicare only pays hospitals 85 to 90% of their cost of delivering the services. Medicaid is only about 66% of the cost. And I want to emphasize that those programs are designed to pay a percentage of cost. It's not charges. You know, our charges are pretty much irrelevant when it comes to Medicare and Medicaid. So that's a perennial issue. That's something that we struggle with all over time. But things get further complicated by the additional cuts to hospitals and health systems that are baked into the Affordable Care Act. You know, I think everybody is glad that access to insurance and access to health care is improved by the Affordable Care Act. But what I think most people don't understand is that hospitals, through cuts today and into the future, are being expected to pay for that increased access. So the result of all this market pressure is that nearly a third of Virginia's 100 hospitals have negative operating margins. And in rural communities, it's especially acute. I think about 20 of the 37 rural hospitals have negative margins. So those challenges are very real, and you might say from a financial perspective, we're bailing water, and there's a great big storm coming with these future cuts on the horizon.
Well, it just doesn't look good. And the bottom line is, I think, when you laid it out just in Virginia, $1.5 billion that you charged out and didn't get back in. I mean, it would be like any company if you had an annual bad debt or write-off, if you will, of $1.5 billion. I mean, you just can't stay viable. It's just too much. It's just too high, right? I mean, that's a huge number, Jim.
Yes, and that can't be sustained. I mean, if we don't find a solution to this, I think going forward, clearly, it's going to be much more difficult to ensure the type of health outcomes that Virginians are accustomed to and deserve. But a less obvious but also very significant impact, if we don't find a solution, is going to be economic, the economic hardship impact.
Right.
Hospitals are large employers in Virginia. I think we, as an industry, employ over 115,000 people directly and account for about $36 billion in economic activity. So about 1 in 9 jobs in Virginia is somehow related to healthcare and hospital systems. So if we don't come up with policy solutions, it really will be destabilizing, not only to your local community hospital, the healthcare industry, but potentially Virginia's economy as a whole.
We've got to get off fighting about Medicaid expansion, and we've got to get on to talking about how we solve this issue, because I think really a lot of this, Jim, has become highly politicized with one ideology on one side, the other ideology on the other side. But math is math. $1.5 billion, I mean, that's not conservative or liberal. That's not expanding government or not. It's $1.5 billion that you just don't have. Jim, from your perspective, what are the consequences in Virginia if we don't get to the bottom of these issues and start to solve them now?
Well, we must find a solution. Obviously, it can impact healthcare, it can impact the economic development, and we think that there is a solution, despite obviously we have big political divisions. But the ideal starting point from our perspective is simply for all of our elected leaders from all across the spectrum to acknowledge that hospitals' challenges are real. We can no longer take for granted that the quality of health care, the vitality of employment will be here forever.
Right.
I mean, I think we can just look at Lee County and the closing of the hospital down there to see that. So we need for those political leaders to find a compromise that will produce a positive outcome for their constituents throughout Virginia. And remember that in many communities, hospitals are the center of the local economic system. They support many other businesses and make positive contributions to the economy. So the issue of this ACA funding cuts, sequestration, Medicare, Medicaid reimbursement inadequacy, and uncompensated care aren't going away. And the hospital systems within the state are certainly willing to work with all policymakers to find some creative solutions, build a broad consensus, and to be flexible in doing that.
All right, so Jim, bottom line we got to find an answer, right? And obviously Medicaid expansion, look, this has been debated by the Virginia General Assembly over and over and over. It's not going anywhere. Then just the other day, the Richmond Times-Dispatch cited a story about the costs of booming Medicaid expansion enrollment in expansion states, and that brought into question whether the Commonwealth really lucked out by not expanding Medicaid, because some of the states that had expanded it, whatever their estimates were, it was way, way up, Ohio being one of them, and Kentucky being one of them. So when you look at that and you say, okay, maybe Virginia did the right thing in not going for Medicaid expansion because it could potentially bankrupt these other states. How do you respond to that? How do we get something that's going to work here?
Well, John, I think it's important to point out that Virginia hospitals and health systems didn't advocate for the ACA. But it's 5 years later. There have been 2 Supreme Court decisions, lots of votes in Congress, and the ACA has survived, and it looks like it's here to stay. So that's the framework that we have to work within, whether anyone likes it or not. As you know, I think Virginia hospitals last session, supported the Marketplace Virginia alternative that the legislature considered. So we're very open to creative solutions. I think even the governor last weekend in a Roanoke Times column said that his door is open to anyone who wants to work to find solutions to modernize our healthcare systems, and we share that view. And as for the issue of the enrollment in many states outpacing what was projected, I think those stories kind of overlook the economic benefit to those states that came from growing enrollment. If you think about it, large enrollment means, number one, greater access, and 2, fewer uninsured people. But in expansion states like Kentucky, for example, there was a savings in the general fund requirements with those funds that came from expansion through the Affordable Care Act, and a very sizable decrease in the uninsured rate. And in Virginia, were there to be expansion in some form that's politically acceptable to all, that would probably generate in a neighborhood of an additional 15,000 to 30,000 jobs in the Commonwealth of Virginia in a time, frankly, where employment is not growing. So that's what we're hoping for in Virginia, and we'll be very active in communicating with the public and the General Assembly about the importance of hospitals as obviously health care providers, but also employers in local communities, especially in rural Virginia.
Well, Jim, look, when hospitals are cutting services and they're going under and they're leaving communities because they can't make the numbers work financially, no business, whatever it is, stays in business in perpetuity in the red, something has to be done. This issue is not going to go away. So it seems like we got to find some kind of a compromise that is going to work, that, as I said earlier, is not ideologically charged. I think if we can find that, we might be able to solve our way out of it. We want to thank Jim Cole for being with us today, longtime president and CEO of the Virginia Hospital Center in Arlington, Virginia. And Jim is also the chairman of the Virginia Hospital and Healthcare Association and a nationally respected executive who has led his hospital to be recognized as one of the best hospitals in America. Great to have you with us, Jim. Thanks for being with us.
Thank you, John.